Okay, so everyone, we are recording this. So again, if you have friends and family that weren't able to make it, please feel free to go to the website at generations808.com, and you can click on any of the past webinars we have. And this webinar, and actually this entire year, and hopefully next year too, has been sponsored by FBI. So thank you very much to them for being a sponsor of the Generations Magazine webinars. We have these webinars every month. It's usually the third Wednesday. If you're checking your calendar, this is the fourth Wednesday. Last week we had the HPGS conference, so it interfered with that. So we wanted to make sure that people could attend the Generation Magazine webinar. So today we have Candace Young and Ship, and they will introduce themselves. But I did want to do a few housekeeping. Please use the chat feature and the Q&A feature for any questions you may have during the presentation. We're definitely going to have a Q&A at the end. But if something that they're talking about, you have a question on specifically, please feel free to use the chat feature or the Q&A feature on the bottom of your screen, and we will get to those questions. Again, thank you for attending. This is the September 22nd webinar with Ship, and I will turn it over to Candace.
Thank you, Cynthia. So I'm going to share my screen and pull up our PowerPoint. And then I'm going to present. And so thank you, Cynthia, for the introduction. Today, we're going to be talking a little bit about Medicare basics. But before I hand the presentation off to May, I just kind of want to preface at the end of today's presentation, I will be chatting a link in the chat box. And this chat link will take you to a quick survey that you can participate in. And so I'll talk a little bit more about the survey towards the end of the presentation. But without further ado, I'm going to pass the presentation on to May. May?
Thank you, Candace. Aloha and mahalo for joining our team for this presentation on Medicare basics. We shipmates 3, Jean, Stephen, and May, are honored to be here today. We'll spend an hour to give you more power, the basics of Medicare to navigate, to find you a plan with the best rate. By exercising your clear vision and voice, you're bound to make the best insurance choice. We hope you like this introduction, composed especially for you. Next, please. We are certified volunteers for SHIP, the State Health Insurance Assistance Program, which is federally funded and administered by the Department of Health and the Executive Office on Aging. We offer assistance to everyone in Hawaii, as well as to beneficiaries elsewhere, who, of course, will be advised to contact their own SHIP in their own residential area. Next, please. Hawaii SHIP provides these services upon request. We provide personalized counseling, which is confidential, by trained and qualified counselors who provide free, unbiased, accurate, and localized information, assistance, and referrals to beneficiaries. We conduct public presentations to groups and organizations live or on Zoom like this one on many specific topics concerning the services of Medicare. We also connect with the public by participating in fairs and exhibits. Now, for any of these services or materials, please leave a message anytime on our helpline, 1-808-586-7299, or toll free, 1-888-875-9229, or you may contact us on our website at hawaiiship.org, which is a very informative new site that will answer many of your basic questions. Our policy is to assign a counselor to return your call within 5 business days or even sooner. And a counselor can also contact you through email if you provide your email. Next, please. Today, we are going to explain 5 major parts of Medicare. First of all, the parts of Medicare A, B, D, and C, and also Medigap. 2 options, Original Medicare and Medicare Advantage. Next, important enrollment periods available to all beneficiaries. Next, low-income subsidy programs for beneficiaries who do qualify. And finally, some helpful resources as well as partners of SHIP. Next, please. Now let's take a look at what basic Medicare is and what's important to understand. First of all, it's an entitlement health insurance for you who are 65 and older, for those under 65 with certain disabilities and may be recipients of SSDI or Social Security Disability Insurance or income, or for those already receiving SSDI for 24 consecutive months or 2 years when they will qualify on the 25th month. Now, for individuals of any age with ESRD, better known as end-stage renal disease, or ALS, known as amyotrophic lateral sclerosis, and better known as Lou Gehrig's disease, will also be eligible. Next. Now let's take a look at 2 major organizations that oversee Medicare. First of all is the Social Security Administration, which first of all enrolls beneficiaries into Medicare Parts A and B. They collect the premiums for Part B and also Part A for those who must buy this part. And then finally, they administer the Extra Help Program for low-income beneficiaries with Part D premiums, co-payments, and co-insurances. The next large major organization would be CMS, or the Centers for Medicare and Medicaid Services. They are the managers of your health plans who will coordinate and handle benefits for beneficiaries. CMS sets the annual premiums, deductibles, and overall coverage for Medicare. Another function is for CMS to credential or authorize the network of participating Advantage providers to ensure the approval of benefits and services offered by Medicare. CMS processes the claims that are made for services, supplies, items for beneficiaries in Original Medicare. Next slide, please. Now, are you still in a daze about what Medicare A, B, D, and C are all about? Well, it's normal for anyone, new or old, to feel confused. Let's go over this diagram that will make it easier to see how Medicare offers choices and options. The first option, okay, on your left of the screen, referred to as Original Medicare, includes Part A, or hospital insurance, while Part B covers medical services like your office visits for annual checkups or a clinical procedure not requiring an inpatient hospital stay. A standalone Part D drug prescription plan is suggested with original Medicare to cover your drug needs. And along with original A and B in the bottom left corner is Medigap, a supplement plan which will provide additional coverage not covered by A and B. Therefore, the appropriate name for the policy, Medigap. Now, on the right side of this chart, the C or Advantage plans are offered through Aloha, HMSA, Humana, Kaiser, Ohana, and United Healthcare in Hawaii. To qualify, you must first be enrolled in A and B, and you must have received your Medicare card. Now, you'll notice that Advantage is just one big block in red and pink instead of 3 or 4 separate red and pink blocks, indicating it's a comprehensive all-in-one plan, unlike original, which is a la carte, like when you're charged separately on the check for your salad, your entree, and dessert when dining out. Now, Part C may also have a built-in drug rider with other benefits like dental, vision, hearing, and preventive services. Next, please. Now let's further fine-tune original Medicare A and B in more detail. Part A, again, is for inpatient care in a hospital and includes short-term nursing facility care, but it does not cover long-term care. Now, if long-term care is needed, the options are to buy a long-term care insurance policy or to qualify for Medicaid, which is for those with limited income and assets. Part A also includes home health care and hospice care. Let's take a look at Part B, which is outpatient care. So this will cover your doctor's office visits, telehealth or telemedicine, lab tests like blood work, x-rays, scans, and heart tests. DME, or durable medical equipment, including canes, walkers, wheelchairs, hospital beds, and preventive services like shingle, flu, or COVID shots would also be covered. Now, here's an example to help you better visualize the differences between Part A and Part B. Just imagine going to ER and not being formally admitted to the hospital. This is outpatient, so you'd be covered by Part B. But if you're formally admitted to the hospital for an injury or surgery, this would be covered by Part A. Next, please. Now let's take a look at the premiums for Part A. Well, they're totally free. You already may know that A is premium free if you or your spouse worked and paid Social Security taxes in the US for 40 plus quarters or the equivalent of 10 years, which may be cumulative. Also, you may be eligible for premium-free Part A due to a disability, ESRD, or ASL. And please remember, that there are deductibles, co-pays, and co-insurance costs for Part A services. Next, please. Now, when can you enroll in Part A? If you're already receiving Social Security benefits at age 65, so the Social Security Administration will automatically enroll you in Medicare Part A and B. Now, remember that Medicare is not mandatory insurance, but since Part A is free for most of you, you probably will be enrolling when you turn 65. Now, if you don't have the 40 quarters or 10 years, you can still enroll, but you will have the following premiums that you see on this chart for the year 2021. $295 a month if you have 3 quarters, and $471 a month if you have less than 3 quarters. You may enroll at any time after age 65 if you qualify for premium-free Part A without a penalty. So remember to contact Social Security to enroll in Part A as a new beneficiary. Now, I will hand this over to Jean, who will continue with Part B.
Good morning, everyone. I'm Jean. I'm a volunteer counselor for the Hawaii SHIP. I will take over for May. Thanks, May. You did a terrific job. I like your rap in the beginning, too. I hope everybody appreciates that. May did that all on her own. Okay. So anyway, we're going to start talking about Part B. So what are Part B premiums and costs? For 2021, Part B premium is $148.50. I would say most people will pay $148.50. We're heading toward the end of the year now, so in maybe a couple months, CMS will be coming out with 2022 premiums. Hopefully it doesn't go up. I've seen it go down on a couple of years. Hope it just doesn't go up. Okay, so since the majority of people pay $148.50, let's talk a little bit about the people who are have higher incomes. They pay a premium for Part B adjusted to their earnings. So in 2021, for an individual, if you had adjusted gross income that's $88,000 or less, your premium is $148.50. For a married couple, it's $176,000. If your income is higher than that, there's a table delineating how much premium you're responsible for paying. And if you're interested in that table, call our SHIP office, helpline 586-7299, and ask us for a breakdown and we'll give it to you. It's just a little bit too much information for you today for us to give to you. Anyway, Part B costs, these include the annual deductible. And for 2021, the annual deductible is $203. So if you go to the doctor, get medical supplies, get a lab test, the first $203 of these services you have to pay before Part B kicks in. So Part B will include this annual deductible. It includes co-pays and co-insurance for services. And for most Part B services, Medicare pays 80%, you will pay 20%. Okay, so if you aren't able to afford paying for these Part B costs, there's a low income subsidy program called MSP, Medicare Savings Program, that you can apply for. If you qualify, then you will get some of your Part B payments costs paid for by Medicaid. Yeah. So anyway, next slide, please. How do I pay for my Part B premiums? There are several different ways that you can pay your Part B premiums. Most people Social Security benefits. So if you are receiving Social Security benefits, then Social Security will deduct it from your monthly benefit. So if you look at the statement that you get from Social Security, it will have a breakdown of all the deductions from your Social Security check. If you're not receiving your Social Security benefits, you will be billed monthly by CMS. And you can pay this bill manually. And since 2020, you can create a Medicare.gov account. So go to the Medicare.gov website, create your own account, and it will allow you to pay your Part B premiums online. Okay, and your Part B premiums will be determined by Social Security upon enrollment. And your premiums thereafter will also be determined by Social Security, and that's going to be based on your income. A caveat for those people who want to create a Medicare.gov account to pay your Part B premium, if you're being billed by CMS to pay your monthly premium, make sure that you continue, excuse me, that you continue to pay your premium to CMS until your Medicare.gov payment through the website activates, because you don't want a gap where you stop paying and the account has not come on board yet, because that gap may potentially lead to non-payment, and with non-payment, Social Security will stop, and you will have a problem trying to get back on it. If they don't give you a waiver, you will only be able to do that during general enrollment period. You may be faced with a penalty. So be very careful when you do that. Yep. Okay, so next. Okay, so that's Part B, premiums and costs. Now let's talk about Part D. Part D, as in drugs, is prescription drug coverage. It's available as a standalone drug plan. It's called Part D, and it's in conjunction with Original Medicare. So if you're interested in seeing the various different Part D drug plans that are available in Hawaii, you can look in your Medicare and You 2021 handbook. It's updated annually. And for this year, you can find that list on page 125D to 125G. So all the different plans that are available in Hawaii are listed there. And I think there are like about 15 of them. Okay, in order to get a prescription drug plan, you must reside in the service area. And for prescription drugs plans, the service area is all of Hawaii. Also, there's no international coverage. So if you travel internationally, you find you need to get some prescription drugs. There's no international coverage, so you're going to have to pay out of pocket for that. So what does prescription drug coverage have? So each plan has a formulary or a list of covered prescription drugs. And each plan's formulary is different. Some are richer than others. And usually the driver for determining what the formulary is for your drug plan is the premium cost. So if you pay more for premiums, the formulary is richer, the co-payments may be a little less So those things you have to determine based on your own drug needs and your ability to pay. Yeah. So Part D costs include the monthly premium, and the monthly premium can range from about $7 a month to about $90 a month. So you determine for yourself what, plan is going to be best for you based on your drug needs and your ability to pay. The costs also include annual deductibles. I forget what the annual deductible is for, the max deductible is for drug costs, but some plans have deductibles, some plans don't have, and it's all determined basically by how much premium you pay. They all have co-payments and co-insurance. They have different tiering of your drugs. They have different restrictions. So, based on your needs, you need to be very careful in determining which plan is going to be best for you. If you have problems paying for your Part D costs, there is a program that's administered through Social Security. It's called Extra Help. It's a limited, what is it? I'm having a brain.
Low income subsidy program?
Oh, low income subsidy. Yes, thank you, Candace. It's a low income subsidy program. It's called Extra Help. And if you qualify, it's based on your income and assets. And then they will assist you in paying your Part D premium. And also it'll lower your copayment and assist you with the gap periods that come with Part D plans. Okay, next, please. All right, should I enroll in Part D? Most of these questions about Medicare that people have, we always say, it depends. Yeah, it depends because you ask yourself, do you have creditable drug coverage that's provided either through an employer, through a separate retirement plan, or some other drug coverage that's equal to or better than the Medicare coverage. If you do, you don't have to sign up for a Part D prescription drug plan. You won't suffer a penalty later on if you lose that and have to enroll. Okay. Another question is, will the employer drug coverage end when you retire? And most employer provided drug coverage usually ends when you retire. How much do you pay for your current prescription drugs? How much can you afford to pay for a Plan D plan premiums? Are the prescription drugs currently on the plan's formulary? These are questions you have to ask yourself. When you ask how much do you pay for your current prescription drugs and you want to make a decision whether you sign up for Part D or not, some people say, I don't take any drugs. Why do I have to sign up for a drug plan? Well, yeah, it's a voluntary thing. You sign up for a Part D plan, that's your decision to make. Just remember that if your drug needs change in the future and you require expensive drugs now that you have to pay out of pocket, if you sign up for Part D and you don't have a special enrollment period to avoid paying that late enrollment penalty, there's a late enrollment penalty that you will have to pay, and it's a lifetime late enrollment penalty. So these decisions that you make about whether you sign up for Part D when you are first eligible or when you are eligible without penalty is something that you have to decide for yourself how much you can afford to pay out of pocket for now or into the future, whether you have to pay penalties or not. Okay, next, please.
Jean, I
Yes.
found that the Part D deductibles range from $445 for some drugs to $0. So that's the
Okay.
range.
Okay, good. Yeah, and the driver is really how much premiums you pay. That determines how much of the deductible is assessed against you. Okay, so let's talk about something else now. This is what is a Medigap plan. As May had told you earlier, if you have original Medicare A and B, yeah, you can pick up a Medigap plan. It's and another term for Medigap is Medicare Supplement Insurance Plans. They're both the same. It's just two different names you can call it. Okay, Medigap plans are there to really supplement what Medicare doesn't pay for. So these are plans that are sold by private companies. And in Hawaii, there's like about a dozen different companies that sell Medigap plans, and they've been approved by the Insurance Commission here in Hawaii. So if you go to those companies, then you can be assured that they've been vetted by the Insurance Commission, and you can, pick and choose which one you want. Okay, so these plans may cover deductibles, co-insurance, co-payments. And if you look at the chart on the right, the Medigap benefits that you see there are the different benefits that you can get by determining which plan you sign up for. So the most comprehensive plan will pay for all of these benefits: Part A co-insurance, Part B co-insurance, blood, hospice care, skilled nursing co-insurance, Part A deductible, Part B deductible, foreign travel, Part B excess charges. Depending on how much coverage of the benefits you want will determine which plan you pick: A, B, C, D, F, G, and so on. F is the most comprehensive right now. However, F is not available anymore to beneficiaries who turned 65 after January 2020. If you turn 65 before that, then you're grandfathered in, you can still sign up for it. I don't know why they took it off the market, but that's how it is. Okay, so just remember that the letter tells you how many benefits are covered by that plan. And plans across the United States with the same alphabet will cover the same benefit. So these plans are all the same across the United States. The only difference, and it's an important difference, is that each insurance company that sells each of these plans can charge a different premium for the exact same plan. So when you shop around for a Medigap plan, please shop around and call the different companies that offer the plan that you're interested in to find out what they cover and how much it costs in premium. Okay, so next. All right, what should you consider? Okay, I thought I got ahead of myself, but I didn't. Okay, who should consider buying a Medigap plan? That's a hard question to answer, and people have to really look at their own individual circumstance to determine whether buying a Medigap plan makes sense for them or not. A Medigap plan really, if you can afford it, is the most comprehensive coverage you can get, because A and B will be covered under original Medicare. You pick up a drug plan, and the Medigap plan will pay for whatever, depending, as I said, on how many benefits you want, will cover whatever original Medicare doesn't cover. So, for example, Medicare pays 80%, you pay 20%. Depending on which plan you pick, they will cover the 20%. Yeah. It makes sense for people with recurring out-of-pocket expenses due to serious illness or injury that requires a lot of follow-up care. So especially people with ASRD and ALS, it makes sense, yeah, to go with a Medigap because it'll cover all your recurring out-of-pocket. I'm going to talk about the Advantage plans later on, but Advantage plans have co-payments, co-insurance. So you'll have some expenses out there. Okay, so those are things to consider when you decide whether a Medigap plan is right for you. Okay, next.
Jean, can I also mention that Medigaps are only to offset Part A and Part B costs, not the drug costs. So
yes, yes, thank you. If you go with original Medicare and pick up a Medigap, if you want drug coverage, then you will have to pick a standalone Part D drug plan. So, as May said in the beginning, this is a la carte, yeah? So you have to pay for your A and B premiums. You have to pay for Part D drug plan premium. You're going to have to pay for your Medigap premium. So there's a lot of front end costs for this kind of coverage. So you have to add it all up, make sure that it makes sense for you, that you can afford it before going, in that direction. Okay, so when is the best time to buy a Medigap plan? And there is a best time for picking up a Medigap plan. So coverage, the open enrollment period, also called the guaranteed issue right period. This begins when you're 65 years of age and enrolled in Medicare Part B. Okay, a lot of people think that they have to do it at age 65. Not necessarily so. You have to be age 65 and enrolled in Medicare Part B. So a lot of people who are still working, who put off signing up for Part B because they have employer-provided health insurance, they don't have to sign up for a Medigap until they lose their employer coverage and enroll in Part B. So this then the guaranteed issue right period kicks in. It lasts for 6 months. During this period, and it's really financially important for you to enroll during the guaranteed issue right period, because during this period, plans cannot deny enrollment. So even if you have ESRD and you have ALS, those kind of illnesses that cost a lot, they cannot deny you enrollment. They also, monthly premiums will not be based on your age, pre-existing conditions, gender, or your health. So they cannot do medical underwriting on you. The premium will be the basic premium. So when you get in the front door, it's the basic premium. That premium, they cannot raise it to you unless they raise everybody's premium. Okay, so outside of the 6-month period, you can still buy a Medigap plan, but it may cost you more, and there may be restrictions imposed, and sometimes they may not even offer you a plan to sign up. Yeah, so the companies selling Medigap plans now, once you're outside of the 6-month period, have more limitations, on, you have, what am I going to say? They can impose more costs on you and limitations on enrollment outside of this 6-month period. Okay, so consider Medigap if you want to stay with original Medicare. And another thing, about determining original Medicare or a Medicare Advantage plan, you need to talk to your doctors about see whether your doctor takes original Medicare or not. Listen, stay with original Medicare if your doctor says, oh, we don't do Medicare. And some of them say that. Okay, so what is Part C? Part C is Medicare Advantage plans. And these are private plans approved by Medicare, and they're as good as or better than Medicare, original Medicare. And similar to the prescription drug plans, on your Medicare and You Handbook 2021, on pages 120A to 120D, you will see a summary of the different plans that are available in Hawaii. And in order to sign up for a Medicare Advantage plan, you have to enroll in Parts A and Part B. Without Part A and B, you cannot sign up for a Part C plan. And these plans, the benefits and costs differ between the plans, and they differ on each island. So a service area in Hawaii does not encompass all of Hawaii. Usually it's divided by island. So Honolulu is one. The Hawaii Island is another, Kauai, and Maui, which includes Molokai and Lanai. Those are different service areas. So the plans may differ between the different service areas. It's all determined by which service area you live in. Not all the plans are available in all the service areas. So if you're on Oahu, lucky, you have a lot of choices. If you live on the Big Island, ooh, your choices are very limited. Yeah, and limited also on Maui and Kauai. All right, so Medicare Part C plans. What kind of plans are there? There are two different types. One is an HMO plan, and the other is a PPO plan. An HMO plan is a health maintenance organization plan, and it requires the members to stay within the network of participating providers. So you cannot go outside this network unless you get approval from the plan to do so. So usually HMO plans are a little cheaper because they kind of control where you can go to go get service. A PPO plan offers coverage for services from in-network and out-of-network providers. So, you can go to any doctor you want. You just will pay more if you go to a doctor that's not in-network for that plan, but they still will cover it. HMOs, they're like Kaiser, Ohana, Humana has an HMO. PPOs are like United Healthcare, HMSA. Humana has a PPO also. Yeah. So determine, how you want to receive your care under what kind of providers that, will direct your care, will determine whether you want an HMO or PPO. So most plans include a built-in prescription drug rider. I think there's only one that doesn't have it. So all the others include Part C, include a drug rider. So as May had told you earlier, it's oh, excuse me, I'm sorry, I have to hang this up. Carl, answer that, please, sorry. Sorry, I'm at home. The phone rings. Okay, where was I? All right, so where am I? Oh, okay, the PPO and the HMO. So it depends on how you want to receive your care. Yeah, and as May was telling you earlier, the Advantage plans Part C is an all-encompassing package. It includes your hospital, your medical, your drugs. It can also include vision, dental, hearing benefits, and some of them offer riders that you can, pay extra for to get coverage. So if those things are important to you, look at the plans to see what's available and make your decisions that way. Okay, so next. Okay, how do I choose a Medicare Advantage plan? So things to consider when choosing a plan. How much can I afford to pay for monthly premiums? There are several plans that have zero premium. So all you have to do is pay for your Part B premium that Social Security collects from you, and the plan does not have additional premiums. Those are very, very attractive because you don't have to pay any more out of pocket for premiums. Of course, the more premium you pay, the richer the plan is. So if you want premium plans, then look to see if they offer the kind of benefits you want and you can afford to pay for. So you get what you pay for. Yeah. So another question you have to ask yourself is, do my doctors, hospitals, and pharmacies participate? So as I told you earlier, whether it's original Medicare or a Medicare Advantage plan, talk to your doctor before you make a decision on which plan you want to go or which way you want to go to see if they're covered by the plan that you want to choose. Because if the doctor or the provider is not a participant, then no sense go to that doctor because you're going to have to pay out of pocket. Yeah, you have to either find a new doctor or choose another plan. Another big question, especially as I said in the Part D prescription drug plans, is to check the formulary. So if you don't take any drugs, then any plan is okay, right? Because you don't take any drugs. But if you do, and your drugs are higher tiered than the basic, then make sure that one, the plan covers the drug, yeah, and two, that you can afford to pay. Then you also need to consider which plan covers the services I want most. So for a lot of people, fitness is important. So they look for plans that include fitness. Dental, vision, hearing is important. So they look for plans that cover dental, hearing, vision. So, it all depends on what you want. Okay, so next. All right, so here's a comparison. Original Medicare versus Medicare Advantage. So under Original Medicare, there is annual deductible that you have to meet first. There's no limit on out-of-pocket expenses. So if you have a catastrophic injury or illness for that year, Medicare will pay 80%, you pay 20%, and there's no limit on the 20% that you pay. Okay, so if you don't want to be hit with these catastrophic out-of-pocket expenses and you want to stay with original Medicare, then you should consider adding Medigap supplement plan. That'll take care of the out-of-pockets. Yeah. You must also add a Part D prescription plan, and every Part D prescription plan comes with a premium. So that's an added expense. There's no vision, dental, or hearing under original Medicare. But a good thing about Original Medicare is that you can see any Medicare provider nationally. So the coverage travels with you across the United States. So if you get hurt or sick, when you go to Vegas, you can use your Medicare card and see a provider there as long as they're a participant. Okay. Oh, and Medicare doesn't cover foreign travel, so forget about that one. All right, so a Medicare Advantage plan, Part C. There are no front-end deductibles for A and B services, so that's good. They have an annual maximum out-of-pocket, or what we call MOOP. And the annual maximum out-of-pocket is limit annually on how much you pay out of pocket. So for example, if you have a catastrophic injury or illness, you pay your share of all the copays. It depends on which plan you pick, what the maximum out of pocket is, but it can run between $4,000 to $10,000. Once you hit that limit, the plan will pay 100% of the cost. So that's a nice benefit to have because it puts a limit on how much you pay out of your pocket every year. Medicare Advantage plans do not allow you to add on a Medigap insurance plan. If somebody sells you a Medigap insurance plan and you also have a Medicare Advantage, that is not allowed. Okay. And most Medicare Advantage plans have drug coverage, so it's already included. So if you pick up, one of these plans that are zero premium, then your drug coverage, it has zero premiums also. So that's really nice. And many of these offer vision, dental, hearing. So as I said, if those benefits are important for you, look to see if the plan that you're signing up for offers the benefits that you think is important to you. And unlike Medicare that travels with you all over the United States, Medicare Advantage plans are limited by your service area, except for urgent or emergency care. So if you go up to the mainland for travel, then for routine care, you probably your plan probably won't cover it. But if you have emergency or urgent need, then your plan will make an exception for that. So when you sign up for a plan, look to see how much coverage that the plan will offer you outside of Hawaii if you happen to be traveling a lot. Okay, next, please. Oh, all right. I will now hand off this presentation to Stephen. He will continue on and talk about the administrative side of Medicare. I talked about the meat and bones of Medicare. Now he will talk about the administrative side of Medicare. So Stephen, thank you very much. You can.
Okay, thanks, Jean. So on the next few slides, I'm going to first talk about the process of enrolling in Medicare. How do you enroll in Medicare? And then spend some time talking about when to apply for Medicare, because there are different periods when you can enroll depending on your situation and your need. And we'll wrap up by touching very lightly on some of the low-income subsidy programs available for Medicare beneficiaries. And some of what I am going to say has already been covered, but we'll reemphasize it. So first of all, enrollment in Medicare. We've already stated that if you are already receiving Social Security, you are going to be automatically enrolled by the Social Security Administration for both Part A and Part B. Also, if you are on disability, once you are on disability for 24 months, then you will be automatically enrolled for Part A and B. However, if you are not drawing your Social Security benefits, it's necessary for you to take the initiative to enroll. And you can do that through one of several channels. You can do it online. You can go to socialsecurity.gov, and that's probably the quickest and most efficient way of enrolling. As an alternative, you can call Social Security. We've provided the toll-free number, the 800-772-1213, or the local Social Security office, and they can assist you with the process. The second bullet, going in person to your local Social Security office, that was an option up until the pandemic hit us, and it's currently not offered. So again, you'll need to go online or call Social Security in order to enroll. And by the way, I might add that if you decide that you also want to enroll in a Medicare Advantage plan, you have to enroll with that plan after you have completed the enrollment process with Social Security for Part A and B of Medicare. All right, next slide. There is an option for enrolling for Part B online. We've provided the link on this slide. It's also possible to submit hard copy forms to enroll for Part B. We've provided the fax number that your forms can be sent to, or of course you can mail the forms to Social Security. Next slide. So now we're going to talk about the timing of when you can enroll for Medicare. So for those of you who are turning 65, you have the opportunity to enroll during what's defined as the initial enrollment period. It's a 7-month period that starts 3 months before your 65th birthday. So if you were turning 65, say next month in October, you could actually begin the process. The initial enrollment period actually begins in July. And then this period extends 3 months after your 65th birthday. So that would mean, in the example that I gave, it would end the end of January. So you have the 7-month window to apply initially for Medicare. If you miss this window, then you may be subject to a late enrollment, a lifetime late enrollment penalty. So it's important not to enroll late. You can delay your enrollment if you're working and you have creditable coverage through your employer. Again, by creditable, we mean coverage that is equal to or better than Medicare. And the initial enrollment also starts after you receive your, for those on disability, once they've been on disability for 24 months, then the initial period begins after the 24 months is completed. Okay, next slide. So if you don't enroll during the initial enrollment period, then the next opportunity to enroll for Medicare would be the annual general enrollment period. This takes place during the first 3 months of each calendar year. You can enroll during this time in Medicare Parts A and B. Coverage doesn't begin until July 1st. And if you did not have, keep in mind that if you did not have creditable coverage before enrolling, there will be a late enrollment penalty. The late enrollment penalty for Part B is 10% of the Part B premium for every 12-month period when you were first eligible to enroll in Medicare. So as an example, if you waited until you were 67 to enroll in Part B, and that's 2 years past your initial enrollment period, you would pay a 20% penalty on the $148.50 a month that is currently the Part B premium. That 20% amounts to $29.70. So that means that for the rest of your lifetime, you would pay an additional $29.70 on top of whatever the premium is for Part B. Yeah, most of the, and May had indicated this earlier, if you qualify for Part A, you can sign up for, we recommend that people sign up for Part A because it's free when they turn 65. But if you don't, you can sign up for premium-free Part A at any time. So the annual general enrollment is much more of a factor for people that are signing up for Part B for the first time. So again, try not to miss signing up for Part B when you become eligible for it. Next slide. So for those who continue to work beyond the age of 65, or if you're covered by a spouse who is working, when you and you're covered through your spouse's coverage beyond the age of 65, then if that coverage is creditable, then you don't have to sign up immediately. You don't have to sign up until you lose that coverage. And typically that means when you or your spouse retire. And when that happens, that triggers a special enrollment period. And the special enrollment period lasts 8 months. So you have an 8-month window to enroll for Part B. The window is a little different for Part D. It's 63 days. Not sure how that was determined or why it's such an odd period of time, but it is what it is. So keep in mind that the window is narrower to sign up for Part D than it is for Part B. I've already explained what the penalty for late enrollment for Part B is. The penalty for Part D is a little different. That's determined by multiplying 1% of the national base beneficiary premium. I know that's a mouthful, but that amount this year is $33.06 times the number of uncovered months that you didn't have your Part D coverage or creditable coverage. So keep in mind that if you qualify for this special enrollment period, you won't have this late enrollment penalty for Medicare Parts B, D, and A, as long as you do sign up within the special enrollment period. All right, next slide. There are other events that may trigger a special enrollment period, and some of these scenarios are listed on this slide, such as if you move from one service area to another, or if you disenroll from a plan because that plan provided you with misleading information or misrepresented what the coverage or benefits are, or if the plan that you're covered under is no longer available in your service area. Next slide. One of the concerns that some people have is, well, if I make a choice, what happens if I'm not satisfied with the choice or something else comes along that I think is better? When can I make a change? And there is an annual open enrollment period every year. We're coming up on one very soon. The next annual open enrollment period starts October 15th and runs through December 7th. and the changes go into effect the beginning of the following year, January 1st. And you can make a number of different kinds of changes to your Medicare coverage. You can switch from original Medicare to a Medicare Advantage plan. You can switch from, you can go in reverse. You can go from a Medicare Advantage plan back to original Medicare, or you can change from one Advantage plan to another Advantage plan, or you can sign up for a Part D prescription drug plan. You can make a change there that goes along with your original Medicare Parts A and B. All right, next slide. And there's even one more period when you can make enrollment changes, and this is for those persons that sign up for a Medicare Advantage plan, and for some reason they're not satisfied with it and they want to make a change. So there is this Medicare Advantage open enrollment period. It covers it occurs during the first 3 months of each calendar year, and changes go into effect the beginning of the following month after the change is made. And the changes you can make are to switch from one Medicare Advantage plan to another Advantage plan, or to switch from Medicare Advantage back to original Medicare. All right, next slide. So for those Medicare beneficiaries who have lower incomes and would like to get help for the cost of their premiums or their out-of-pocket costs, you may be able to qualify for one of these 3 programs. First of all is Medicaid. And in order to enroll for Medicaid, it's necessary to contact the State Department of Human Services, DHS, the MedQuest office, and they would assist you with determining whether you meet the eligibility requirements. For Medicare beneficiaries, there are limitations on both income and the assets or resources that you can have in order to qualify. Then there is something called the Medicare Savings Program. It's very similar to Medicaid in that if you qualify, you the benefit is that you will not have to pay the monthly premiums for Part A and B, including any late enrollment penalty, and there will be coverage for the out-of-pocket costs that are not covered by Medicare Parts A and B. So this would be true under both the Medicare Savings Program and Medicaid, and you also would work through the MedQuest office to determine if you are eligible. The final program, and it's already been alluded to earlier, but it's called Extra Help. And this is for Medicare beneficiaries who need assistance with their prescription drug costs. So it would apply to the drug plan premiums and the out-of-pocket costs like the deductibles, co-payments, and co-insurance amounts. Here, the enrollment is handled through Social Security. So you would need to apply through Social Security. It is possible to do that online, or you could call the Social Security office to get assistance with that. Next slide. So this slide is just a wrap-up summary of some of the key points that we've tried to make during this presentation. That Medicare is a federal plan. It's administered by CMS. Original Medicare covers a broad range of medical services, but it doesn't cover all services. So certain services, such as long-term care or dental, hearing, and vision, are not covered. Beneficiaries do have options. They can choose between original Medicare versus Part C or the Medicare Advantage plans, and the Medicare Advantage options that you have varies depending on where you live. It's important to choose a plan that is the best fit for your individual needs, such as the doctors that you are seeing and the medications that you're taking. I've tried to explain what the key enrollment periods are to either enroll initially or to make changes in your enrollment. We can't emphasize enough, please enroll in a timely fashion to avoid late enrollment penalties for any of the parts of Medicare. And we've also explained the availability of the low-income subsidy programs to help with coverage of Medicare premiums and drug costs. And finally, Hawaii SHIP is there to provide free assistance to anyone who needs help in understanding Medicare and options available to them. And most important, you can get personalized one-on-one assistance with your Medicare questions. Next slide. So this slide lists some of the resources available to you, both phone numbers and websites. So Medicare.gov is listed along with their toll-free number. Medicare Interactive is an excellent resource if you want to get more specific questions answered or have a more detailed understanding of how Medicare works. Of course, the Social Security Administration is the gateway to get enrollment with Medicare. You can see the national toll-free line, and we've also provided the numbers for the different offices. There are 2 offices here on Oahu, in Honolulu and Kapolei, and then on Maui, the Big Island, and Kauai. And then the number and website for the Senior Medicare Patrol, in case you have a concern about possible fraud and abuse. And finally, the long-term care ombudsman program, where you can get some information about available long-term care facilities and questions related to long-term care. All right, next slide. And this is our wrap-up slide for our presentation today. Again, we want to thank you for your attention during the presentation. I know that we covered a lot of ground. We have listed our helplines and our website. So for those of you who are interested in calling to get one-on-one counseling, or if you're interested in a presentation, you can call these phone numbers. Our website has a lot of useful information in it. And we also want to add that we are very interested in having more volunteers join us to help us in assisting seniors throughout the state. We would welcome that, and I think you would enjoy many of us have enjoyed the experience of helping seniors and other Medicare beneficiaries with their questions about Medicare. So with that, I'm going to turn the time back to Candace. She'll add a few comments, and then we'll open the floor to questions.
Thank you, Stephen. So earlier in the presentation, I mentioned a survey that you can participate in. And so like May mentioned, our program is federally funded by the Administration for Community Living. And so there's a SHIP in all states. And so they wanted to survey the SHIPs to see how we are serving the community. And so like presentations like these, they want to ensure that we are presenting the information in an accurate and reliable source, and that it was understandable to the audience. So if you could, I'm going to chat in the chat box once I stop screen sharing the link to the survey. And the survey was created by our national funders. It's anonymous. It takes less than 5 minutes. It's a 10-question multiple choice kind of survey. And so we would really appreciate it if you could fill out that survey and give us some much needed feedback. And also I wanted to plug quickly the volunteering. Stephen, May, and Jean are very dedicated, seasoned volunteers, and we're always looking to add more volunteers to our group. And so you can inquire about volunteering through our helpline or our website. Either way, you'll be directed to me. I'm the volunteer coordinator, and I'd be happy to explain and provide our application and help you along. So without further ado, I'm going to stop screen share. And then I'm going to quickly chat the survey link in the chat box, and then we can go ahead with the question and answers. So I know that there were 2 questions. One was submitted through the Q&A function, and one was submitted through the chat function. So I'm going to go ahead and do the chat one first. So one of these people she'll be 64 this October. If I start receiving benefits in January of 2022 and auto-enrolled by Social Security timing-wise, when do I apply for Part C? So she gets auto-enrolled into A and B. She's asking when she can apply for Part C. Does anyone of the presenters want to take that?
Yeah, I think I can answer that. So you can enroll with a Part C Medicare Advantage plan as soon as you turn 65 and get auto enrolled by Social Security for your Medicare Part A and B.
I'm assuming that when you say you're auto-enrolled, you're receiving your Social Security benefits prior to your 65th birthday. If you receive your Social Security benefits before your 65th birthday, Social Security will auto-enroll you in A and B. So it becomes effective the month of your birthday. I don't know about the effectiveness come January 1st. Did you choose to have it become effective that date? But it's likely that if you're auto-enrolled by Social Security into Medicare, it'll start the month of your birthday. And once you're enrolled in A and B, then you can select a Medicare Advantage plan for 2021 that starts, if you do it before the month of your birthday, you can have it start the month of your birthday. So it'll run October, November, December, and come January, it's a new plan period. So a new plan, becomes effective in January. I'm not sure if that's your situation. I'm just a little curious about why you're choosing to have your Medicare start in January.
And
Yeah, I thought she was saying her Social Security would start in January.
Yeah, so she's turning 64 this October. And then she wants to start receiving her Social Security benefits in January of 2022. So she's not 65.
65 next year. She's going to be 65 next year.
Right.
Yes, 65 in October of 2022. Not this year.
Okay, I didn't understand that. Okay. Yeah, that makes sense. That makes sense.
And also too, we have to remind them that they need their Medicare card. So that has to be issued first, right? Before the Advantage plans will consider you for enrollment.
Yeah, they need the number, yeah.
And that takes about, 6 weeks, or how long does it take for the Medicare card to come?
Yeah, that it may just to expand on that a little bit. The Advantage plan will actually accept you or enroll you once you get confirmation from Social Security that you'll be enrolled. You don't actually have to wait for the card.
Okay.
So that was my experience.
Okay.
So it saves a little bit of time, but you're right, there is a bit of a delay. They have to get that confirmation from Social Security that their Medicare enrollment has been accepted and it's in process, and that's at that point the Medicare Advantage plan will can start the enrollment process for them.
So does the confirmation come through, can it be accepted orally or does it have to come in writing, you know, in
It's a
some
le-
document?
it's a letter. Yeah.
It's a letter, right,
Yeah, you
that you
receive a letter.
receive. Yeah,
Yes.
okay.
The second, I think it's a comment. High utilizers of healthcare should seriously look into a Medigap plan. Those wanting to see the best and the best is in the mainland to them should be on a Medigap plan. Those that have a second house or want to visit their children on the mainland for an extended time should be on or consider a Medigap plan.
I just want to share one experience from not a beneficiary, but a very good friend who did not have a Medigap plan for an much older husband who had many medical issues. And she was in perfect health, but within a few years, well, she joined Medigap before, okay? After a few years, she came down with cancer that had invaded her body. And she shares with me from time to time that, you know, Medigap has managed to pay for everything, you know, the therapy, the treatments and the drugs and so on. And so she says that has been a lifesaver. I just wanted to share that.
A question, is the Medigap plan good to use when you travel, like when you go to Vegas monthly?
Yes. As long as you have original Medicare, or as I said, original Medicare travels with you across the United States, and the Medigap also would do that.
Yeah.
And the Medigap, some plans have the foreign travel benefit.
And some plans do have the foreign travel benefit, yes.
But I think I want to add something about the Medicare Advantage plans, because I think that we may have given the impression that the Medicare Advantage plans have very limited coverage outside of the service area. And I would say, first of all, it depends on the kind of Medicare Advantage plan that you have. If you have an HMO plan, yes, your coverage, your coverage for services outside the service area may be limited to urgent or emergent care. But if you have a PPO plan, the PPO plan will cover the services of any provider throughout the country. It's just a question of whether the service will be considered in network or out of network. And many of the Medicare Advantage plans, and I know this, Candace knows this because I just recently had to research it, but many of the Medicare Advantage plans, the PPO plans like HMSA, like Humana, like United Healthcare, have basically established the equivalent of a national network of providers. So when you are traveling outside the service area, if you are in a service area where that company, that health plan has a PPO in that area, you can go to the PPO providers in that area who are contracted with that plan, and it will be considered in network. It will qualify for in network coverage. So the PPO plans will definitely provide coverage out of the service area. It's just a question of whether it will be in network or out of network. And these PPO plans, as I said, have really tried to make it possible for people to receive in network coverage by going to providers that are contracted with the PPO plans in those areas.
Okay, we have a few more questions. I just want to clarify with the individual who mentioned about enrolling into Medicare. So you determine when you start collecting your Social Security benefits. That's up to you. And so with the auto enrollment into Medicare, let's say you started to collect your Social Security benefits. You're turning 65 in October of 2022. That means your IEP, your initial enrollment period, starts in July. And so Social Security will auto enroll you into Medicare during your IEP. So you wouldn't need to do anything if you're already collecting Social Security benefits. But for those who are not collecting Social Security benefits when they turn 65, they will have to contact Social Security to enroll. There is another question. If I enroll into Part B during my special enrollment period, when can I enroll in Part C? Also, when will the coverage start? So that's the 2 months. So.
Yeah, I
Can
think
you
that-
repeat that question? I kind of lost
Yeah,
it.
So they
didn't
just
we
wanna know,
go over that? Oh,
So if I enroll into Part B during my SEP, they want to know about the SEP timeframe for Part C. So that's when I checked it was around 2 months.
Yeah.
Very similar to the Part
Like
D.
Part D, yeah.
Yes.
right.
And then when will the
It's 2
coverage
months.
start? I think the following month, I believe.
Yeah.
Okay. Any other questions? You can chat it, and then we can try to address your questions. We have a few more minutes left.
There was another chat question.
Yeah, I think so.
Oh, I addressed her question about,
Oh,
and she
okay,
just said thank
okay.
you.
Oh, right. I see it. Yes.
Any other questions, guys? If there's no questions, we can end early.
Well, one question I've been asked, by those pursuing Part B for the first time, what kind of documentation should you seek? Just in case later on, there might be questions during your SEP when you do retire. Can it be orally? I would think not, because there's no way you can record that really, right? So does it have to come on a letterhead from the company, stating that this person does have creditable coverage at this point, while still working? That's a question I've been asked.
Yeah, my understanding is that, yes, it has to be in writing from the employer, the source of the creditable coverage. Yes.
Okay.
Oh, and lastly, before we end, the copy of today's PowerPoint presentation can be found on our SHIP website. It's located at the frequently asked questions tab. All of the slides are listed there, just in case you didn't take notes. Cynthia?
Thank you. So I did want to say thank you to Jean, May, Stephen, and Candace for a great presentation. I learned a lot. My grandparents go to Vegas like every month, so that's why I was like, I'm not sure what kind of coverage they have, but I don't need this stuff now. But I know just from experience and from clients that this stuff can get very confusing, and I thought this was very well presented and it was very clear. So thank you so much for an awesome job. Really awesome. So for everybody else, we also are taping and recording this webinar. So it'll be on the generations808.com webpage. You can look under webinars, and all of our webinars from today and past are also on our website. So please go and visit generations808.com. In addition to these brown bag lunch webinars, we also have a radio podcast every Sunday from 8 to 9 a.m. on 101.1 Coral, Hawaii's Classic Rock FM, Spectrum Channel 883, and streamed at www.hawaiistream.fm. So we also have a radio podcast as well that's weekly. Other than our webinars and our radio show, again, our Aging in Place workshop that we usually have in August has been postponed. We had to cancel last year's, of course, through COVID, and this year we're pushing it back with all these different restrictions. We're going to look at doing it in spring 2022. So please be on the lookout for that. And if you're a company and you want to participate with that, please let me know. I do also handle the Aging in Place workshops. Our next brown bag webinar will be next month, October, I believe it's October 20th. And this is going to be on Social Security, Medicare, and retirement. And the speakers will be MDX. They're going to have a special speaker for us. So again, thank you for joining us. We are being recorded. Go to our webpage at www.generations808.com to view this again or to share it with your friends. If you have any questions, feel free to give us a call or chat with us via email. Again, thank you so much to the 4 of you, and thank you for everyone who signed on today. Have a great day and see you in October.
Thank
Bye.
you.
Bye.
Bye.
Aloha.